Hello everyone, I am urologist Omar Makaya. Today, I will talk about a new, high-quality article published in a journal on premature ejaculation. Here, they divided the patients into two groups. One group received penile head filler treatment. The other group received botulinum toxin, Botox, injections into the muscle at the base of the penis that contracts during ejaculation to allow semen to exit. This publication compared the two treatments and evaluated the benefits patients experienced after treatment. It's a really good publication. 2 months after the filler treatment, it was found that the ejaculation time of the patients increased from 1 minute to 7 minutes, while in the Botox treatment, it increased from 1 minute to 3 to 3.5 minutes. Patients in both groups benefited significantly from these treatments for premature ejaculation. Whether 3.5 minutes or 7 minutes is good is debatable. Ultimately, the ejaculation time increased by 3.5 times in one group and 7 times in the other. Filler treatment yielded more successful results than Botox treatment. Of course, treating premature ejaculation does not simply involve injecting filler into the penis and sending the patient on their way. Ultimately, when the patient comes in, their sexual knowledge is assessed. Rhythm, depth, pelvic floor control, breath control, issues in the relationship or position, these need to be evaluated, explained to the patient, and, if necessary, enriched with medical treatments. Friends, it is very difficult to say that this is a standalone treatment. If the patient has erectile dysfunction or anxiety, they may still experience problems related to premature ejaculation. Friends, in fact, it is necessary to sit down and re-evaluate and discuss this. If you attempt to perform premature ejaculation filler treatment or botulinum toxin treatment without doing these things, the success rate of your treatment will naturally be lower in patients. Therefore, it is necessary to evaluate these issues with the patient and develop a roadmap. In premature ejaculation filler treatment, hyaluronic acid injections are performed. Hyaluronic acid is a substance that has been used for 10 years before our premature ejaculation filler treatment, especially to plump up the cheekbones. It should also be noted that there is no standard protocol for premature ejaculation filler treatment. There is no protocol regarding the specific amount to be administered to specific points or the use of sensorimetry. In fact, sensorimetry was not used in these studies. There is currently no specific sensorimetry for the penis in the world. Apart from that, which filler should be used? Is there a filler that has been approved by official health authorities? Is there a filler that has been approved by the FDA, European Health Commissions, or the Turkish Medicines and Medical Devices Agency? No, there is no such filler on the market. There may be fillers that companies themselves have approved for use on the penis. But there is no filler that has been approved by any official authority in this regard. We generally prefer firm fillers to thicken the penis and soft fillers for the head of the penis. The most important thing here is to handle the tissue where the filler is applied with care and sensitivity, without causing harm to the patient. This is one of the most important issues. One of the main advantages of fillers is that they can be applied 3 times in a row if necessary. We don't have to do it all at once. The patient can evaluate the results after the filler is applied and request additional fillers if needed. Or, when sensitivity decreases significantly, there is a chance to reduce the filler. Of course, the success rate of this treatment is not 100%, friends. Even if we increase the patient's knowledge and perform penile filler, the success rate varies between 80 to 90%. We must definitely provide sexual therapy to the patient, friends. If the patient is still resistant, we can also support them with medical treatments. Or we can apply cryoablation therapy, the freezing therapy. Or we can perform a procedure called selective dorsal neurectomy, which is a permanent nerve severing procedure, friends. In general, that's how I wanted to explain this publication. It's a good publication. Thank you for listening. Best regards.